So I grew up in the Arizona Valley. I'm a Parkinson mood disorder specialist. Is it okay if I don't use my mask?
No.
What?
No.
All right.
That's Big Tony. Big Tony speaks.
All right, so I'm a Parkinson's specialist out in Phoenix, Gilbert area. Just out of curiosity, have any of you used Inbrija or heard of it? What? Okay.
What's it called?
Inbrija.
Spell it.
Inbrija.
Okay, thank you.
No? Okay. Very good. We got a bunch of patients that first time introduction. All right, sounds good. So I'm just gonna go through these slides pretty quickly, and then we'll kind of open it up for questions and such. So what is Parkinson's disease? So Parkinson's is a degenerative disease of the brain. There's a region in the brain called the substantia nigra that generates dopamine. In Parkinson's patients, this area dies prematurely or begins to die. And so the amount of dopamine in the brain and the blood begins to decrease. The lack of dopamine has many different symptoms. Most of them are constellations of your Parkinson's. This is very important. So I actually advise all my patients to be physically active as well. We have several rock steady boxing programs in Phoenix as well. A lot of my patients participate in that. So this is a really, really good program that you guys are in. So the symptoms of Parkinson's vary from patient to patient, so not everyone has the same degree of Parkinson's. You have tremors, you have walking difficulties, shuffling, freezing, falls, chewing and swallowing difficulties, drooling, and then there's a lot of non-physical manifestations as well, such as memory problems, anxiety, depression, sleep problems. Patients have poor digestive health, and that's because the stomach and everything slows down in Parkinson's, so you're not digesting food as well. The goal of Parkinson's medications, there's numerous medications out there. I could spend hours going through all of them. The goal of the medications is to control and suppress your symptoms. Unfortunately, there's no cures available, and there's no treatments that can slow down the disease either. So all the medications are there to control and suppress the symptoms, so that try to make you feel as normal as possible, so that you have a good quality of life. Before I talk about Inbrija, I want to talk about on and off symptoms. Just out of curiosity, do you guys know what those are? No? Some of them are. So, as Parkinson's advances, all Parkinson's patients will begin to have the on and off phenomenon. So what that refers to, or also known as the motor fluctuation, what that refers to is when the carbidopa levodopa is active in your blood, you'll feel better.
I'm sorry, this is Godiva, Diva, whatever. All the talking over there. Sit your lap. That's right. So as the carbidopa levodopa is active in the blood, you feel better. You feel great. Most patients feel really good on the carbidopa levodopa. That's what we refer to as the on state, because physically your body's on. As the levodopa wears off, and before your next dose is due, that window of space is going to be called the off period. In the beginning, you don't have that because you're always going to be on, because the levodopa lasts a long time and it overlaps with each dose. As the disease gets more advanced, the window of the levodopa begins to shrink, and so patients have the ups and downs. And typically that's why the amount and frequency of the levodopa needs to be increased. So start at one tablet 3 to 4 times a day, and in about 10 years, a lot of these patients are on 2 to 3 tablets 6 times a day, for example. And that's because they need more levodopa to keep up with the disease. So on and off periods, and during the off states, that's when all your symptoms come back. You can have more tremors, you can have balance issues, you can
freezing, locking up, drool starts coming out more. Sometimes the symptoms aren't even physical. Patients can have a lot of anxiety and depression during the off stage as well. So yeah, this kind of goes over what I just said. Motor and non-motor symptoms, all of these can be present during the off stage. Any question on and off periods before I move forward? No, that's pretty clear. Jump to Inbrija. Okay, so what is Inbrija? So Inbrija is the only inhaled levodopa product on the market. So what that means is this is an inhaler, similar to patients have their asthma inhalers and things. It takes the levodopa pill, not the ones that you're on, the special tablets for this, in an aerosolized form. So you put it in, and then you inhale it, and the levodopa starts working pretty quickly. The benefit of this is the levodopa bypasses the entire stomach and digestive tract, and so it hits the lungs immediately and then into the blood. And so it starts working really quickly. You notice a benefit within 10 minutes, and you'll be back full in your on state at the half-hour period, and benefits last a full hour. You can use this up to 5 times a day. So what that means is, when I prescribe this to my patients, let's say they're having 2 to 3 off periods a day, and sometimes they can be random. They can be out at a restaurant, and all of a sudden they get off, and then they have a hard time getting out of their chair in the restaurant. Waiters, servers have to come help them, things like that. This is an example of this being handy. Their wife or spouse keeps that in their purse. They need it, they inhale it, and in about 10 minutes they start noticing the on state come on. Versus your oral levodopa takes usually about 30 to 40 minutes to begin kicking in. So this is much faster and hits that peak much quicker. Obviously it only lasts an hour, but that's how this is designed. It's designed to be a quick on and off rescue medication. So like I said, the levodopa enters through the lungs, into the blood, bypasses the stomach tract entirely. The stomach is where the levodopa gets slowed down. So you take your pills. Yeah, sorry.
So if you're on the pill, and you take that as well, is that okay?
That is okay, yeah. So the most common scenario for that is in the early morning. So a lot of patients, they wake up, they haven't had their levodopa in 8 to 10 hours, right? And so they're really stiff and have a hard time getting going in the morning. So what they do is they take their oral levodopa, but remember, it doesn't kick in until about 30, 40 minutes. So then they puff one of these as well, and that gets them going. And when this wears off, their oral levodopa is already metabolized and ready to go.
Has Medicare approved it?
Yes. Yeah, this is FDA approved for Parkinson's, so all insurances will cover this.
Almost 3 years now.
So there's a slide I wanted to show. That's actually kind of interesting. Do you know if that slide's here with the stomach?
It's only in the.
It's only in it doesn't work. There was a slide that's in the physician deck that shows it's an endoscopy view of a Parkinson's patient's stomach. And it shows your yellow levodopa pill in the stomach after 2 hours of taking it. So how many of you have taken your oral levodopa, expect it to work, but somehow this hasn't kicked in?
Yes.
That happens pretty frequently, right?
Yes.
Okay, the reason for that is the oral metabolism is not perfect, it's inconsistent. And the older you get and the more advanced your Parkinson becomes, the more inconsistent that oral levodopa gets. And so even though you're taking it 4, 5, 6 times a day, it's not always going to kick in. And the reason is it doesn't always get metabolized by the stomach. It doesn't make its way through the intestine. Your diet also interferes. I'm assuming many of you have been told that protein interferes with the levodopa, right?
Yeah.
And so you had a steak or a cheeseburger or something before you took your pills, that's going to even make it worse. The benefit of that is you don't have to worry about that with this. It bypasses that entirely, goes directly to the lungs, and into the blood, always consistent, always gives you that on state. Okay? The side effects of this, since this is the same thing as your levodopa, the side effects are identical. So what that means is that for people that have hallucinations on the carbidopa levodopa, have the dyskinesias, some people get really sleepy and fatigued on the levodopa. Yes, those side effects will carry forward to this, but there's not going to be anything new and different in this compared to the oral form, with the exception of cough. The most common side effect I have in my patients is cough. The reason is it's a powder, and so in the beginning it's a little uncomfortable for you to get used to that, because you feel like a powder rushing through your lungs and hitting your throat. Patients have a cough. About 6 to 9% of patients have a little bit of a colored sputum as well because of the powder. It makes their spit like a dark brown, blackish color. That's nothing to be concerned about. It's just a reaction of the medication with your saliva.
The one thing I would add on the cough is we now have nurse educators. So when he prescribes, within 24 hours, a nurse will contact the patient and they walk them through, they Zoom, they FaceTime, and they really give a positive first experience to make sure that you understand how to kind of drink a little water, take gentle inhalations. And usually after the first day or two, patients get used to that feel of the powder and it's not an issue and it disappears.
Yeah, it says in the beginning, and a lot of patients have a little trick. They take some water before they use the Inbrija, and so that coats the lining of the throat, makes it a little bit easier. But yeah, the cough is the biggest side effect I've seen. And then, yeah.
Does it not also sometimes have headache?
Wait, sorry?
Headache?
The headache from this, or?
Yeah. Do you get initially, along with the cough, sometimes a headache?
Oh, a headache? Rarely. So some people do notice a headache with the carbidopa, like levodopa products. Yeah. It's cough.
So if you're coughing, the automatic thing to do would be to drink water, and that's okay?
Yeah, that's okay. A lot of people drink water even before, and so that moistens the throat, and so makes the cough more manageable.
What's the equivalent dosage of carbidopa, levodopa, something for that?
So each capsule is 42 milligrams of levodopa in this, and a dose is 2 capsules. So what that means is when you take this, you're going to take 2 puffs. So you put a capsule in here, you take a puff, you put the second capsule in here, and you take a puff. So that is a single dose. So that's about 98 milligrams of levodopa. So that's equivalent. Now your 25-100 levodopa has that same dose, but remember, a lot of the levodopa that you take orally gets degraded by the stomach acids. And so you're not getting that full 100 milligrams when you take it orally. So this is a more enhanced, pure form of the levodopa. For those of you who've seen like the pump, the duopa pump, that also has similar, because the duopa bypasses the stomach and goes into the intestine, so it gives a more, a pure version of the levodopa. So in that standpoint, so yeah, the 98 milligrams is the dosage of this. But you feel it because, unlike the oral levodopa, this does not get degraded when you take it.
So is it just the levodopa or is it the carbidopa levodopa?
Wait, sorry?
Is it just the levodopa or is it both medications?
No, this is just the levodopa.
It's just levodopa. Okay.
And the reason that's important is you can't take this on its own as a single medication. So what that means is that unless you're taking the carbidopa levodopa orally, you can't be prescribed this. So
I see.
I wouldn't, if I had a patient that wasn't on anything, I wouldn't just give them this.
Right. Okay.
Because it doesn't have the carbidopa component, and so if you just take levodopa alone, you're going to have a tremendous nausea and vomiting.
Oh, okay. I see.
So every patient that's on oral carbidopa levodopa, that can be the extended release, Rytary, any of that, those are the ones that can get this as well. Now that doesn't mean you need to take them together. It just means that you need to be having some type of carbidopa running through your system.
Mm-hmm.
So if you're taking your pill, 3 to 4 times a day, that's fine, and then you can use this whenever you feel like the symptoms are coming up. Does that make sense?
Mhm.
Yeah. Yeah.
You're saying that it makes you cough, one,
Uh-huh.
and two, it gives you headaches.
All carbidopa levodopa can potentially cause headaches. Yes.
I've never had headaches from mine, carbidopa, levodopa. Okay? And the plus is, the high is that it makes you good, makes you okay between prescriptions.
Correct. Yeah, the benefit is this is used as a rescue medication. This is used if you need like a dramatic on.
So it doesn't replace anything.
No, this does not replace your oral carbidopa
Okay.
levodopa, no.
I take Renteria, and I take carbidopa, levodopa. Can I still have to take them between doses, right? If that's the only time I can use them.
You can use it along with your carbidopa levodopa, that's fine too, but you need to be on an oral carbidopa levodopa regimen, yes. So you're not going to be able to stop your oral pills by taking this.
The goal of this obviously is to give you that booster or that kick when your levodopa carbidopa stops working. So it's a rescue. It's kind of like an asthma inhaler
It's an
when you have
yeah.
symptoms and you want to have them in control. It gives you the opportunity to do it. And by the way, the headache is not one of the common side effects. It's just
Right.
you know, levodopa carbidopa. Pretty much every drug, if you look at the side effect profile, has headache, but it was not a common side effect.
Yeah,
the common side effects he mentioned were the cough.
No more than 5 shots a day, right?
Up to 5 shots a day, yes. Or 5 puffs, whatever.
5 tablets?
Huh?
How many tablets usually? 5 shots?
So each shot of this is 2 capsules. And so sorry, I think you asked a question earlier. When I ordered this, it comes with the device and it comes with a packet, a blister of the levodopa capsules. Those capsules are only to be used in this. You cannot swallow those. Those are not designed to be swallowed. And they'll look completely different. There'll be a long, white, powdery capsule, and that's the one you put in this.
And so you put those in there and then,
Yep, put it in. That's it.
what does it do to that film?
It crushes it.
Oh, okay.
And then it releases the powder, and then when you inhale it, the powder sucks through your lungs and then goes into your blood. Yeah.
Recommended by themselves, or like for my pills and my meds, I have spray for my throat and my mouth,
Uh-huh.
and the pills just slide down there instead of water.
For your oral pills, yeah, but you can't swallow the capsules in this. You have to use
No.
the inhaler, yeah.
But you said to drink some water before or after.
That's for if you're having cough while using this. Yeah.
Okay.
So if you have a spray that also works, you can use that too. The water is just a suggestion that I've seen a lot of patients use when they're on this. So I think that's pretty much it for my slides. So then let's open it up for questions. And you can ask me questions on this. You can ask me questions on Parkinson's, anything you want.
What can you tell us about cost?
Cost?
Yeah.
That's a me question. Obviously, that's a more complex question because it depends on your particular situation, how many drugs you're on, do you have a secondary, do you have a Medicare supplementary? Generally, historically, I know commercial patients, this is $30 a month. VA patients, it's $11 a month. TRICARE patients, it's $33 a month. When you get into Medicare, usually what we suggest is get samples from your doctor, and pretty much every doctor in town has some samples, and then submit the paperwork, and then the company will work with you. In fact, if you ask them for patient assistance, we have up to 5 programs that can get the cost all the way down to 0, but you have to talk to them and figure out based on your financial situation. So it's a little more difficult to tell. I mean, it could be 0, it could be $500 a month, and then you have to decide if it fits your needs. So I wish I could tell you exactly, but in the Medicare situation, there's just so many other things going on. Because everyone here probably has different plans, different supplements and stuff like that. But the best thing is, if it sounds something that you'd like to try, talk to your local physician, ask for some samples, and let us process the paperwork and work with you to get you the least expensive that we can. Does that make sense?
So the bottom line is, because I take a couple of medications
Mhm.
that FDA has approved, but Medicare doesn't care if they're approved or not, they don't pay for them.
Yeah.
So it's the bottom line does it fit into any of the categories of Medicare paying for it? You know, there's A through D. Does it fit in any of those categories?
It does in some cases. Again, you know, it's like,
I understand all the other things you're saying.
Yeah.
I'm fighting that every single day.
Yeah,
I'm just
yeah.
saying, is there any level that Medicare covers it?
again, all I can tell you is
Okay.
that historically in 3 years, we have about 70% of our patients that are on this are Medicare. So once they process through, they work with our program, they're able to get them coverage and you know, get it to be
Okay.
cost effective for them. So the best thing I can say is,
Because I had to apply to an assistance program,
Sure,
PAN,
absolutely.
to get my medication paid for.
yeah, and in this case, it will go through on PAN as well.
I see, okay, thank
yeah.
you.
What kind of doctor are you?
Sorry?
What kind of doctor are you?
So I practice in Parkinson's. So I'm a Parkinson's specialist in Phoenix.
Okay.
Yeah. About 90% of my volume is Parkinson's patients. So this is my bread and butter. Well, not Inbrija alone, but all Parkinson's medication. So.
You guys have any other general Parkinson's questions? that
Yeah, you can ask me
for?
about Parkinson's, you can ask me about other meds, you know,
What's the
anything you
latest in
want.
Parkinson's? What's new?
Sorry?
What's new in Parkinson's?
So for new meds, so there's a medication called Ongentys that came out recently. That's similar to the entacapone that patients have been on in the past. It's a newer form of entacapone. The biggest med that's probably awaiting clinical trials right now is the levadopa sub-Q pump. So so Duopa goes into the gut. The same company that makes Duopa, AbbVie, is coming out with a subcutaneous levodopa pump. So that'll be similar to diabetics when they have their insulin pumps. It'll be like a device you just pump into the skin and it shoots the levodopa directly through the body. That's probably the newest thing it's not out yet. It's still in clinical trials, but maybe, you know, in the next couple of years that'll come out.
What
Yeah.
do you think of Rytary? Or Rittery?
Yeah, so Rytary's been around since about 2014. It's a good drug. Cost has been an issue with Rytary. You know, but you know, it falls in the same, like some patients, if they have certain supplements and secondaries, they can get it covered. Certain Medicare plans don't cover it, or don't cover like the bulk of it, so the copays are really large. So the Rytary is a superior version of the carbidopa levodopa. I will say that I think in a head-to-head, Rytary is probably better, but a lot of the times it really depends on cost. And so if a patient tells me that, you know, Rytary is going to cost them $300 a month versus regular carbidopa levodopa is $5 a month, I don't think Rytary is that much better that you need to pay that much of a markup. So that's been the really limiting factor in me prescribing Rytary, is mainly just cost. But Rytary is a little bit better because it has a better peak period, and so patients don't have as much fluctuations on Rytary.
It's terrible the cost of it. I've been on it over a year now, and I'm paying almost $1,000, over $100 a month.
That's pretty normal for Rytary. It's about, yeah, so it's about, it depends on also the dosage and the volume of pills you take. And so, you know, it's just kind of very.
Tell me a lot, but.
Yeah, it's a good pill. I mean, it's a good drug. A lot of the times, though, you know, when a patient migrates from carbidopa to Rytary, the benefit of the Rytary is for the on and off periods, right? But Phoenix is a very heavy deep brain stimulation city, and so we have very strong DBS programs there, and so we take a lot of patients for the brain surgery early on, and so a lot of the times I can bypass the need for Rytary and stuff, because once you have the deep brain stimulator in, you don't necessarily need to be on Rytary. A lot of patients can manage with just the carbidopa levodopa alone. So
Now, another thing on cost, I would tell you, if you don't know this, whether it's my company or any of these companies, Rytary, make sure when you talk or you go on a product that you get in touch and ask for patient assistance. Our organization pays into the PAN program. You know, the way it works is we can't just, we can't negotiate directly with the government on Medicare. Interesting enough, we can negotiate straight with DOD or VA and set up pricing programs. But if you ask, that's the key, is you have to ask a lot of times. The other thing is there's a program called Extra Help. That's a federal program. If you type in Extra Help, you may qualify for that. And those can get you all of your drugs as low as $9. So you might investigate that at another point in time.
Great, thanks.
Yeah.
Extrahealth.com?
Yeah, just type in extrahealth.com, and it's a federal program designed for patients, and there's qualifications, income levels, but it's worth checking out. And there's local business. There'll be a local number for Las Vegas, and you can call and ask and get some information. But all drugs through that program, if you qualify, are $9. So it's worth checking out. Any other questions? This is your chance to pick the brain of a movement specialist on things that you've been
Yeah, I'm
wondering
here.
about on Parkinson's.
I don't have anything to do till the afternoon, because happy hour doesn't start till 4, so.
What's your opinion of DBA?
So I'm a big fan of DBS. I've been using it since I was a fellowship. Now, Phoenix is the biggest volume for deep brain stimulation in the country, second only to Vanderbilt. So a lot of it is really depend on regional. You don't, as far as I know, Vegas unfortunately does not have that same type of infrastructure. The surgeons here don't operate at that much of a volume for deep brain stimulation versus we do, and so it's just kind of dynamics wise. So so I'm a big fan of DBS. As soon as patients start having a lot of on and off fluctuations, dyskinesias, I usually just take it straight to surgery. Just hammer all those things out.
You do it yourself?
No, I'm not a surgeon.
Okay.
We have two big neurosurgeons in Phoenix that focus only on deep brain stimulation. So, yeah. And in fact, we've had patients travel from Vegas to Phoenix just for the surgery as well. So,
You happen to have in memory general statements about the success or the problems they're having with DBS?
sorry, could you repeat that?
Yeah, you mentioned that you're a big fan. They do a lot there. Can you say anything at all about the general success or,
Oh, the pros and cons?
yeah,
Like
and
long term?
outcomes?
Okay, so the goal of the deep brain stimulation is it's not a cure, okay? It is an adjunctive therapy that treats the disease. Deep brain stimulation is designed for a few things. The biggest is it will get rid of the tremors. So patients that have really bad tremors, and I'm not really seeing really bad tremors in this.
right now.
That's not even that bad. I've seen people with
Oh,
black all
no,
over
I
it.
mean, you can see what it's going.
So the deep brain stimulation will treat the tremors better than any of the medications on the market. The other big thing with the deep brain stimulation is it will lower the amount of medications you need by about 50%. So let's say you're on 10 tablets of levodopa a day, I can drop that down to 4 to 5. So the benefit of that is patients when they have side effects from the levodopa, hallucinations, dyskinesias, things like that, those will go away because you're on much less medications. And then the deep brain stimulation fills in the gaps between doses, so it treats the on and off symptoms as well. The cons to the DBS, obviously it's a surgery, so there's going to be surgical risk, but that's universally for any procedure. You break your hip, you need a hip replacement, it's going to be the same risk. The fact that it's in the brain doesn't necessarily make it more dangerous than anything else. In fact, most DBS surgeries are only about 90 minutes, so they're actually a pretty quick and easy procedure for a trained surgeon.
What do they actually do? I'm sorry.
So they drill 2 holes in the skull and they implant an electrode into the brain. So it's like a pacemaker for the brain. And the electrodes send off an electrical shock through the brain that treats and suppresses the symptoms down. The biggest side effect that deep brain stimulation has is that some people do notice some memory problems afterwards, after the surgery. And then some patients have some speech problems. So because of the stimulation, it causes some slurred speech sometimes. So those are the 2 big. The speech? Yeah, it can be permanent. I've seen that. I mean, I've had patients that have a little bit of a slurred speech after the surgery. I mean, it is, it's a trade-off. I mean, they were pretty miserable without it, and so you know, with it, I was able to reduce their meds, took care of on and offs, took care of the tremors.
What
the
about
payoff
long
is-
term,
is-
like after 10 years?
Wait, sorry?
What about long term, like after 10 years?
It's the same side effect profile.
Okay.
It doesn't cause any new side effects.
Okay.
What did she ask?
How long-term DBS?
Like
side
long-term
effects.
DBS side effects.
I think how it impacts.
Oh.
Yeah. The stimulator will need to be periodically adjusted. The stimulator has settings on it that your Parkinson doctor will adjust. And so when you have the stimulator in, every follow-up visit you go to every 3 to 6 months, however you guys are seeing your physicians, is that there will be adjustments made to the medications as well as adjustments made to the stimulator. The stimulator will work hand in hand with the medications in keeping your symptoms at bay. So we implant pretty early. As soon as typically at the 4 to 5 year range, if a patient is having some of the advanced features like tremors are not being controlled, they're having on and off periods, I usually take these patients to surgery.
If, I was reading something that said that DBS only works on symptoms that levadopa affect.
That is correct, yeah. So the DBS will only affect the symptoms that your levodopa can fix. And so what that means is, so I have patients that come in and they're having a lot of balance and walking problems. And they're on high doses of levodopa, but the levodopa doesn't touch that. Unfortunately, those patients are not a DBS candidate because the DBS will not fix that either.
How about people that have like my tremor's not really affected by
The
levodopa?
tremor is an exception. The tremor is the one thing that the DBS will absolutely resolve. Yeah.
And slowness of bradykinesia.
So yeah, those will improve with the DBS because those will also improve with the adequate, like the levodopa titration. But balance sometimes is not always responsive to levodopa. And so when people have a lot of shuffling and freezing and things that the levodopa is not responsive for, DBS actually does not help those patients. Those patients are benefited by duopa. Duopa is the intestinal levodopa, and what's thought to be the case is because duopa gives you a very powerful, pure form of the levodopa right through the gut. And so when you have like this massive amount of levodopa coming in, it's thought to flood the brain with receptors and improve symptoms that the oral medication cannot. So when patients are coming in and they're just have a lot of walking and other problems that I can't fix with other therapies, I usually take them to duopa. So duopa is a stomach surgery. They put the pump port in the stomach, and then you wear a device that gives the levodopa to the
How
gut.
big is that pump?
Probably
About 2 by 5, 2 by 4.
Size of a small suitcase.
They're
no, it's about this big.
Yeah, they're considering one for me, and it's about like that.
Yeah, it's about that big.
It's wearable.
It's wearable. Usually
Yeah.
patients wear it in a fanny pack or
You can do
women
it
hide in their
exercise
purse.
with them.
What?
You can do mild exercise with them and take showers.
Yeah. So,
How about anything about stem cells? I've heard people talk about that. Have you heard any?
it's not FDA approved. So all the stem cells are all third-party vendors just doing their own thing. So that would be something that you take at your own peril. And it's usually insurance won't cover it because it's not FDA approved, and so those are pretty pricey procedures, 15, 20,000 sometimes. So,
And what's the surgery where they deaden parts of the brain?
so that's the gamma knife. So back in the old days, patients used to get like the thalamotomy. So Michael J. Fox had a thalamotomy done. This is decades ago. Thalamotomy is now obsolete. No one does thalamotomies anymore. But they take the focus ultrasound or the gamma knife, which is a radiation beam, and they burn a hole in a part of the brain, make it dead, and that treats the symptoms. It's not as good as deep brain stimulation. It's really designed for patients who are not good surgical candidates. They can't tolerate the anesthesia, and they won't be able to be good. They have very high risk of getting surgery done. Those are the only patients I would shuttle to gamma knife and ultrasound because in a head-to-head, the DBS just has significantly more benefits.
Has Michael J. Fox had DBS?
He's had it. No, he had a thalamotomy,
Right?
so you can't DBS that region because that
that hole is already done. He had it back in the early 90s, and DBS wasn't around back then. DBS came out in the early to mid 2000s.
Any difference in the manufacturers as far as you know? Between
So
Medtronic and-
there's three manufacturers: Medtronic, Abbott, and Boston. The benefits are pretty much all the same. It's really a matter of customer service and things like that. From a physician standpoint, I like Medtronic and Abbott better just because the Boston programmer is kind of clunky and not really easy to use. And so it's just, I don't like using it. It's kind of like the difference between the Windows and Mac kind of thing. But the actual hardware is pretty much the same for all of them. The Phoenix teams are different than your Vegas teams, and so my Phoenix Medtronic team is a better customer service team than the other two competitors. So I use Medtronic more often down there. But that could change in Vegas. I don't know the Vegas landscape of that, so you'd have to ask one of your doctors.
No, I was just curious. I mean, do they all perform the same functions?
They all perform the same thing.
And they perform it in the same way?
Correct. Yep. Same thing. The hardware is exactly the same.
Got a question for you.
Yeah.
What are the biggest don't do's when you're diagnosed with Parkinson's?
Don't do's?
Don't do in life.
Don't stop exercising because exercise is important.
Don't eat those donuts.
And you need donuts. Don't go on some fad Parkinson diet. I see a lot of people Googling these Parkinson diets. They're like, oh, keto's good or low carbs is good for Parkinson. It doesn't really matter. Diet has no impact on Parkinson's, so eat and drink whatever you want. So, there's no evidence to suggest that diet has a change in Parkinson's disease, and so until something comes out, I usually advise my patients to eat and drink whatever they want. Usually as a spouse, be like, he eats way too much ice cream. I'm like, he can do what he wants. So,
Any other thoughts?
no, other than that, I mean, don'ts. No, I mean, well, so I got a guy, he's a Parkinson's patient, and he was an air conditioning mechanic. He was an air conditioning maintenance man for his career. And so he used to do the AC maintenance on his own AC by himself. But that requires climbing up ladders and into the attic and stuff like that. And so he still wants to do that. And I'm like, and then he fell. And I'm like, no, like you can't, I understand you're a mechanic and you don't trust someone else to do the same maintenance on your AC as you do, but sometimes things in life change. So I told him he can't do that anymore. It's things like that. Some people just want to continue with the same habits and things they had before. And some things do got to change. I can't, you're not, depending on how severe your disease is, you're not really safe climbing ladders. You shouldn't be out on the roof doing stuff. Even gardening, if you have a lot of rocks and platforms and stuff, is probably not safe for a Parkinson's patient. So, go get a landscaper, better than you falling and me having to deal with that in the ER. So.
And how much do they know about the relationship of inhaling metals like welding or chemicals with aerosols, stuff like that?
So no correlation has been identified yet. The only risk factor that the government has identified is for Vietnam veterans, exposure to Agent Orange is a causative symptom for Parkinson's.
What about that spray?
So they say that, but there's no literature to support either way. So, yeah.
Support what?
The pesticide uses.
Oh, pesticide, right.
We're talking about pesticide, right?
Yeah.
Yeah.
So what do they think that the major cause of it is?
Gotta ask the big man upstairs. I don't know. It's the cards you're given. It's like a lot of times this is thought to be bad luck.
Why? Bad luck?
Bad luck. So no identifiable cause and effect really, other than Agent Orange has been identified. So, and I get asked that a lot. I get patients, new diagnosis of Parkinson's, like, what do I do to get this? And the answer is he probably didn't do anything. It's just the luck of the draw.
So if they've identified Agent Orange and it's a chemical, then there's a good possibility that other chemicals play a role.
It could, but until they come up with it, I can't endorse that. So, it's all speculation as of now.
Yeah, there's stuff about trichloroethylene
Right.
is a biggie. I was with that for 10 years. Worked with it daily. So, and that, I've seen research on it that there's some people feel that it has a
Well, if you think about it, in the last couple hundred years, the amount of chemicals that humans have ingested is mind-boggling.
Well, thank you very much for your attention, and we appreciate having a chance to share some info and get some questions answered.
Thank you.
We wish you guys a great rest of your day and keep boxing.
Yes, sir.